How's it? Welcome back. Today we're going to be doing something slightly different. We're going to be doing a concept or a series called I Bet You Didn't Know. What that means is that we're going to be covering 2 to 3 topics that you might not have known about, and hopefully I can learn something, you can learn something, and I'd love to have a conversation about it in the comments. So the first one is using ETCO2 to diagnose DKA. So in DKA, we are expected to kind of see a patient who's pretty severely hyperglycemic, and they're going to have increased breathing rate and depth, so Kussmaul's breathing. And another diagnostic criteria that we can look at is ETCO2. So if their capnography is less than 25 millimeters of mercury or less than 3.3 kPa, it's actually a very good indicator of someone being in DKA. So you would have expected potentially their ETCO2 to be high because they're very acidic. But actually what's happening is that because the patient is in a metabolic acidosis, they are now moving into a respiratory compensatory alkalosis. So they're breathing fast to try and increase or bring up their pH, while the increase in sugars is dropping their pH. So I thought that was quite interesting. I didn't realize that this was such a sensitive test. So the next time you come across someone who's quite poorly, they've got really high sugars, they're breathing quite fast, and they're not in shock. Because obviously if we have someone in shock, their ETCO2 will be low. So they're not in shock, they're breathing fast, and they've got hyperglycemia. Assess their ETCO2. If it is less than 25 or 3.3, you have a really good indicator of DKA. I thought that was quite interesting. Next point is the modified jaw lift versus the CE grip. So you more likely than not know about the CE grip. So that's your CE that we put on the mandible and the mask, and we lift to then do ventilations with the BVM. But there's another one which is called a modified jaw lift. So what that is that you just bring your 3 fingers together on the mandible by the chin, and you just lift up. So rather than 3 fingers separate, you bring the 3 fingers together and pull up. They've done studies on this, and they found that when they used the modified jaw lift, they had better tidal volumes. This was done in theater, so it was in a very controlled environment. But I think there's a lot to take from that, I feel. Definitely something that I'm going to consider. The third thing is your ankle-brachial index. What that means is that we take the blood pressure of a patient who's lying supine, so they're lying on their back, and you take a blood pressure on their calf, and you take a blood pressure where we normally do on the arm, and we divide them by each other. So you take the leg blood pressure and divide it by the arm blood pressure, and that tells us the degree of peripheral vascular disease a patient has. So that tells us pretty much how sick they are, in terms of their blood vessels and their hearts and how that's all functioning. And if that ratio is less than 0.5, we have a very strong indicator of cardiac disease and therefore quite a sick person. So if you're ever unsure, or if you ever have the opportunity to try this, take a blood pressure of the patient lying on their back, one on their leg, one on the arm, and then you divide the one on the leg by the one that's on the arm. And like I was saying, if that's greater than 1, that's absolutely normal. That's great. If it's less than 1, like I said, if it's actually less than 0.5, that's a very strong indicator of cardiovascular disease.